The last thing I expected was to get a phone call from my wife, scared and afraid, and the only way out that she's seen at the time was suicide.
From the outside looking in, you would have thought that I had the perfect life. I had 2 kids, I was married, we had a house, I had a job, my husband's got a great job, I was working out, I was feeling good, but for some reason, my mental health just collapsed. My name's Kayla. My husband, Will, and I and our kids are from Penetanguishene. We've lived in this area for over 10 years. Our 2 children, Finley and Novalee, are 11 and 9 years old. I had a very traumatic childhood with losses of my parents and abuse. In 2019, it just all came and hit me like a brick. I got in the car and I just felt like driving my car off the road. So that's when I called my husband and I told him, I'm having these thoughts.
The second I heard that was, reminding her, Kayla, you don't need to feel that way. I'm here for you. You've got 2 beautiful kids at home. I need you to go to the hospital right now.
Walking into triage, the nurse was great. They immediately took me in. I was put in a room right away, actually. Then they made arrangements for the next day for me to be transferred. So I was only at GBGH for 1 night in 2019. In 2021, I was prescribed a medication called sertraline Zoloft, which is an SSRI, that ended up putting me into a medically induced psychosis. I gradually, within a 2-month time frame, just hit rock bottom. When I had opened up to my husband about that, immediately I went to GBGH. What I didn't expect on my second stay was that I would be in a hallway for 2 nights because GBGH was so over capacity. My conversations I was having was being heard throughout the hall, people walking by, and it made a situation that was hard even worse. I believe that if GBGH had the proper supports for mental health, my situation would have been caught sooner and saved me a lot of heartache.
It was hard to have to travel to go and visit my wife when she was transferred to RVH, where if we had care at home in our community, it would make it easier for any families that are going through the same situation. The staff at GBGH, I can't say enough about, because they go above and beyond. They do everything in their power, plus more. Dr. Ralhan was one of the doctors that was able to pull me aside. He explained everything to me, the process, and that we did the right thing, that we got Kayla into their care. Even though they don't have the setup to treat mental health, they still went above and beyond to help Kayla the best that they could. And they were there for me, for my kids, and that was amazing.
When a patient has a mental health concern, we're the only doors in the community that are open 24 hours. Once you arrive here, we have to subsequently transfer you to another facility, and sometimes that can include waiting. Kayla's story shows us exactly why we need access to care. Despite our best efforts in trying to provide whatever care we could for her mental health needs here, Kayla sat in the hallway waiting for 2 days to be able to get that bed that she needed to get the care that she needed.
I still struggle, but knowing that GBGH is seeing me makes me feel better, knowing that if I get into crisis again, I'm gonna be okay.
we need your help. Georgian Bay General Hospital is committed to 24 acute mental health beds to be able to provide access to care. Thank you for investing in mental health care for our community.